Welcome to The Doctor's In. I'm Dr. Freddie Gomez. Thank you for joining us on another episode. Now, as you all know, as of this morning, there have been around 1,418 confirmed cases of COVID-19 here in the Philippines. Now, as more testing kits become available, medical experts say that the numbers will only rise. So tataas lang po ito habang dumadami pong availability ng test kits. So as testing kits become available, we find out who are more positive with this. And as more infections occur, hospitals are receiving more patients than they can. So as a result of this, hospitals are becoming under-equipped, undermanned, and definitely overwhelmed. So to ease the burden of the health workers, our frontliners, technology offers not just a helping hand in this situation, but maybe even a lifeline. So we're talking about telehealth or telemedicine here. So to help us get a grasp on what exactly this technology is, we have on the program Dr. Francis Sarmiento. He's the director of the National Telehealth Center of UP NIH. Hello, doctor, and thank you for joining us here on The Doctor is In. Now, let me get right into it. Dr. Francis, what exactly is telemedicine?
So, telemedicine is the practice of medicine over a distance that is aided by digital health technologies. It is divided into three basic categories. So, number one is the most popular, which is telemedicine consultations or teleconsultations. Number two is telemonitoring, where you monitor patients who provide clinical expertise to the provider
Okay,
is on the
I'm sorry, Dr. Raymond, but your audio is coming in a little choppy, no? I guess one of the drawbacks of some technology that we have to make do right now. So could you repeat that again, doctor, with what exactly is telemedicine or telehealth?
So telemedicine is the practice of medicine over a distance and is often aided by digital health technologies. The three basic categories of telemedicine includes, so the first one is the most popular, which is telemedicine consultations or teleconsultations, which could be divided into either a store and forward system or a real-time video conferencing system between the patient and the provider, or between a healthcare provider and another healthcare provider. The second category is telemonitoring, wherein devices are attached to the patient, and the patient is monitored remotely or over a distance. Then number three is what we call as telementoring. Telementoring is it encompasses everything wherein it includes e-learning. The clinician is able to lend some sort of expertise and additional information on how a particular case would have been handled or should have been handled. Grand rounds have been done using tele mentoring use and application. So those are the things that wherein telemedicine would be very valuable and effective, and then delivering all of those information and services over a distance.
Okay. Now, a lot of this is not actually new here in the Philippines. So telemedicine has been around for a few years, and the initial scheme or the initial use of this was trying to get doctors into far-flung areas, into the barrios where medical help isn't applicable. But now, in this age of COVID-19, how can people benefit exactly from this telemedicine? How will this be able to probably help minimize the spread of the virus?
So during a crisis or during a pandemic such as what we have right now with COVID-19, the central thesis that is being pushed is to promote and practice social distancing measures. So the question arises wherein how do you actually practice social distancing measures wherein when you have an urge or you have a need to see your healthcare provider or to go to a healthcare facility. So telemedicine allows the patient or allows the healthcare provider also to stay away from a healthcare facility and be able to sorry may understand meron
Go ahead, doctor.
okay. So, telemedicine allows the patient and also the healthcare provider to be able to stay where they are and be able to provide their services over a distance. And this is often aided through several mechanisms. But what will be important will be you have an electronic medical record or a medical record of sorts for you to be able to record the clinical encounter and also be able to have ideally video conferencing technology so that the provider will be able to see the patient in that scenario. So in that setup, the patient oftentimes their needs will be could be categorized as an outpatient need or an outpatient consultation. Those consultations will then be addressed and will be consulted with a specialist or a healthcare provider who will be able to help the patient out in that time of need. So only those in and by doing so, only those who would require urgent or emergent care, if it's an emergency, if it is a trauma case, or something that would require immediate admission, and since we have several COVID-19 designated referral hospitals, those are the ones that will need to be quickly identified. But let us not forget that there are also non-COVID patients that will be needing all of these healthcare services also and will be seeking these services, and having these technologies and having telemedicine and having all of our healthcare providers be adept at using all of these technologies will be able to help address the needs of our patients at this time of need.
We'll talk about several ways actually with regards to telehealth, in particular kung anong kailangan ng mga tao, ano, kung anong kailangan na gadget or probably an app. But before we go into that, doctor, let's answer some questions because we all know this is a live broadcast, so people can send their e-questions. Pwede nyo idala yung tanong ninyo via Facebook or even Instagram. So we have a question from Arthur. Do you have specific consultation hours or is this available 24/7? So, Dr. Raymond, meron bang certain time frame ba ito? Parang doktor, during clinic hours lang pwede kumonsulta with telehealth?
Sorry.
My question was, are there specific hours with
Dr.
wherein
Freddie,
a
sorry,
patient can consult
you
with
got cut
telehealth?
off, so I couldn't hear your question.
Okay, my question was, and this was coming from Arthur. He's asking if you have specific consultation hours, or is telehealth available 24 hours a day, 7 days a week?
So ideally, providers would set up a schedule that also follows the regular clinic schedules, and those are the designated hours wherein the healthcare provider would be there, essentially in their clinic space or whatever space that they are in, and they will be able to accept and answer and respond to any telehealth or telemedicine questions. So there are also hotlines that are made available, like the DOH hotline. There's also the recently launched UPPGH Bayanihan Operations Center hotline. Anybody who would want to, who would have any questions or who will want to talk to a healthcare provider, would be able to reach out and have them be transferred to well, especially for the PGH Bayanihan Operations Center, they will be transferred to a healthcare provider to answer their clinical questions.
Now, in terms of technology, if someone is interested, kung merong nanonood dito na interesado sa telehealth, ano ang kailangan nilang nasa sarili nila? May gadget ba ang kailangan? May special equipment ba ang kailangan? Or smartphone lang, Doctor?
So at the minimum, if we are talking about the ideal setup wherein the provider or the clinician will be able to see the patient even virtually, that would require a gadget that will allow that will have a digital camera. So oftentimes it will be a laptop or a desktop with a video camera, or a smartphone with a good video camera that would enable the provider and also the patient to be able to see each other, so that there is still that element of human connection, even though that connection is being done over a distance or virtually. So what will be helpful po, no? So especially for patients who are chronic patients who are being chronically seen by doctors. So examples of these will be hypertension patients, diabetes patients, those who will need to be seen by their doctor every 3 months, or even those cancer patients who do not have any urgent need but will need to have some sort of consultation or checkup that on an outpatient basis with their clinician or with their healthcare provider. Those will be perfect examples wherein the patient and then the doctor, who already know each other, will be able to benefit from the use and the practice of telemedicine during this crisis.
Now, we have some more questions. We have a lot more questions for you, Dr. Sarmiento, with regards to how to join this telehealth movement, to help with this COVID-19 epidemic. But first, we have to pause for a quick break, so don't go away. The doctor is in. We'll be right back. Welcome back to The Doctor is In. I'm Dr. Freddie Gomez. So our topic for today ay telemedicine. So ang telemedicine is para makatulong tayo na hindi mag-congest sa mga hospitals ngayon na COVID-19. And still with me is my guest, Dr. Raymond Sarmiento, who is the Director and Research Assistant Professor at UP Manila National Telehealth Center. Now moving along, Doctor, with regards to there was a question here is with regards to reseta. Paano pag yung doktor may kailangang gamot at kailangan ng reseta, antibiotics or what may be, paano po ito ma-accomplish with telehealth?
So ideally, there are certain systems that have already embedded within itself an electronic prescription, or what we call an e-prescription system. So basically what happens is that even if it is an outpatient consult, and then the doctor enters the patient details in the electronic medical record, that automatically flow when the doctor goes to the management part or the treatment part, that automatically goes to the electronic prescription part. So what do I mean by that? What happens is that when the doctor has already put in all of the medications dun po, no, sa part po ng reseta, the patient also is asked where the medications will be picked up during nung ano po yun, nung wala pa po yung quarantine, but they could also opt to have all of their medications be delivered at their doorstep. So that would require also a connection between the electronic medical record and the pharmacy information system of that particular pharmacy, so that whenever the patient has to, let's say, has to have a medication refilled or has to have a particular medication be picked up or delivered to them, the pharmacy or the pharmacist in the pharmacy will be able to validate and verify that this is an actual prescription that was made by a licensed physician, and they would have to fill out all of those medications po na nakalista dun sa reseta. So right now, Right now, the Department of Health has issued guidelines po, no, on how to issue electronic prescriptions. So part of that was the, I think, memorandum or circular from the FDA on how healthcare providers, particularly licensed physicians, will be able to issue all of these electronic prescriptions. So that is also in support of our central theme, which will be promoting and practicing social distancing measures as much as possible.
Now, you mentioned maraming mga guidelines ang kailangan, ano? So the purpose of this is kailangan po na sure at legal at lahat ng ginagawa ng both doctor and patient with regard to telehealth is being met. Now,
Dr. Freddie, I think I lost
sila
you.
kaagad na magpakita sa hospital. Ayan, can you hear me, doctor? I'm sorry. Am I coming in, doctor? I think there's a little cut.
Yes, can you repeat the
Can you
question,
hear me, doctor?
Dr. Freddie? Yes, I can hear you now.
Yes, Dr. Raymond. With regards to being this situation, COVID-19, maraming nagtatanong kung yung mga simptomas na nararamdaman nila sa bahay, kailangan na ba nilang pumunta sa doktor? So marami ang pwedeng mag-avail nitong telehealth. Ang tanong ko is, agad-agad ba silang pwedeng kumausap ng kahit sinong doktor na gusto nila? Or they must sign up muna into a certain application po ba? Meron bang software kailangan silang mag-register muna bago mapasama sa itong telehealth?
So the Department of Health po has been gathering a list of those software or system providers, and I think very soon the Department of Health will be releasing this list of approved providers naman po in terms of telemedicine or telehealth software that the DOH has assessed and evaluated to be compliant with existing standards and existing laws and policies. What will be important to note po would be, so obviously, just like in any software system or technology, the patient will, and also the provider, will need to be registered in that system so that they will be put into a database and they will be able to track down the specific, let's say, if you're a doctor, what will be your specialty, what are your clinic hours, how, if are you willing to answer this or those questions, that sort of thing. Those are additional questions that will be listed as part of their registration. The patient will also be registered, and the system is then, if it is a truly telehealth capable electronic medical record system, the patient will then be required to enter those initial demographics like name, address, everything. So the reason for that is because there should be a record of the encounter. So it's very important that as if you are treating that medical record that is being done virtually, in the much the same way that you are doing it if it were face to face. And another thing would be, since all medical records are treated as a legal document, so that will be proof that there was an actual clinical consult or clinical encounter that happened. So the challenges right now will be, not all software have that video calling capability. So like I mentioned, the ideal telemedicine setup would require that the physician is able to see the patient, ano po, especially like I mentioned, for those na chronic po nilang nakikita. So even if the patient is not able to be physically examined by the doctor, having that visual confirmation or having that visual sense or documentation that you are that everything is fine, that you look fine, or the physical or visual cues that would point to whether the patient is in distress could be easily seen in that video call. So those are the technologies. So just as any other country has dealt with it, in the Philippines, we could also do some sort of combination. So what ano po bang ibig ko pong sabihin by combination? You will have to have some combination of electronic medical record system, or even if it's a basic one, and then another one that will allow you to basically have a way to do a video calling. So what will be those examples? Those will essentially be the ones that will be compliant with the 2012 Data Privacy Act po, no? And they have listed down from a technological perspective what are the requirements. So essentially, as we have been doing it in the past, it usually the ideal setup is that it has to have end-to-end encryption, especially if you are doing the telemedicine component. There are certain platforms, so I just like to mention that I have no commercial interest, but based on my rapid analysis lang po that we have done at the National Telehealth Center, certain platform that they have been using. I think we are all familiar with Zoom as a video conference or video calling tool. So they have been combining that one and also electronic medical record system. So, but the question would really be, um, it will all boil down po kasi in terms of the payment and the reimbursement part. So in in the Philippines, telemedicine for the most part has been mostly done within a research umbrella with the clinical specialists being paid a very small honorarium for their participation in a telemedicine program. What will be important is that PhilHealth is also on board in terms of if there are certain telemedicine consults that PhilHealth will be open to reimbursing, especially when at this point in time these patients will need to be availing of these telemedicine consults over a distance, ano po. So we at the same time that we are working with the Department of Health, the National Telehealth Center is also working po with the Philippine Health Insurance Corporation, essentially in developing what will be the guidelines, and that will be part of a package for the use of telehealth services as a modular service. Maybe initially po muna for primary care facilities, and then we go to expand.
Now let's answer some more questions online, Dr. Raymond. Ano? So a lot of people have been asking paano na-uphold ang patient-doctor confidentiality para dito. So I'm sure a lot of people are interested in this, especially those who might have mental health questions, nadidepress sila or kailangan nilang may kausap. How is patient-doctor confidentiality guaranteed in these types of telehealth encounters?
So for the patient doctor confidentiality concern, just as sorry po, meron pong ano. Okay. So for the doctor
Ayan,
patient
yes.
confidentiality concern, um, the, there should also be a strict setup on how the doctor will be seeing those patients. So just as if the patient was in front of the healthcare provider, that whole consult should be done in a separate room where there is where there's good signal or good connection, doctor is the only one who is in that part of the house, or maybe in the part of the office, and also the patient would also be recommended that in the same way that the doctor is also, let's say, secluded in terms of having a private area wherein he or she will be allowed to respond to telemedicine consultations. It will be recommended that the patient also be set up in an area wherein audio will be good, and that he or she will be able to explicitly share his or her concerns with the provider that he or she will be talking to. So hindi po ibig sabihin po na this is telemedicine po. It's as if you are parang nasa bahay lang po tayo. Ano po, very important din po that you are having a mentality that you are going to the office of a doctor if you are a patient, and if you are a doctor that you are seeing this patient, and all of the, let's say, necessary setup that you would require. So, ano po ibig sabihin nun? Dressing up professionally, addressing all of the questions clearly, and providing instructions clearly and succinctly. Those are the things that will be essential for having, shall we say, if we could assess it as a successful teleconsultation or telemedicine consultation.
Now, doctor, a lot of people are very interested in how they could join this telehealth. Are all of these, can I join? Can I join this telehealth capability all through my own phone? Kumbaga, nasa computer lang ako ngayon, naka-quarantine ako. Pwede na ba ako mag-enroll dito sa telehealth? And if so, pwede ko gawin lahat ito sa loob ng bahay or gamit ko cellphone ko? Paano ko ito magagawa? Saan ako pupunta? Anong website?
So right now there are several. I think the having this crisis has allowed us to allowed everyone in the digital health community to have their eyes be open, and all of the stakeholders to have, let's say, to have a better sense on how to actually implement this telemedicine practice. So in the past few years, we have been working on a Philippine National E-Health System and Services Act, and embedded within it will be the things that we are talking about, and part of it is the practice of telemedicine. Ano po? So, but to your answer po, what are the, let's say, what are the things that we should be thinking of in terms of how do I avail of these telehealth services? So, number one will be, if just ask yourself, number one po, if you were to go to a particular how do you call it, to a particular provider, if you wanted to go to a particular healthcare facility, what would you normally do, especially if it were an outpatient case? So if you were to do that, so obviously if you have been doing this for several years, you already have, quote unquote, a go-to or your primary care provider to whom you will be consulting. So the for the from the patient perspective, you will have to check if your provider is participating in this telehealth or telemedicine services program. Number two will be what will be the necessary setup that you will require. So kanya-kanya po kasi yun depending on the, let's say, the healthcare provider, or depending on the hospital, if the healthcare provider is attached to a hospital and they are using a dedicated or very specific software. Those are the things that you will need to understand in terms of naka-enroll na po ba ako doon, kailangan ko po bang nag-register, ganun po. And then number two will be from the practitioner side. Are you able, how many patients are you able to respond to, or to, let's say, to cater to through telemedicine or telehealth?
Okay, doctor.
So obviously there. Opo.
Doctor. Sorry to cut you off,
Go
but
ahead. Go ahead.
unfortunately we're lacking in time for this episode. But we will definitely talk about telehealth, telemedicine in a future episode. So if people would like to avail of this, would like more information about this, they should go to UPPGH Bayanihan Operations Center website or the telehealth.ph website for this. So thank you very much, Doctor, for all the information that you've gathered for us. So please do join us next time for another episode of The Doctor's In. I'm Dr. Freddie Gomez. Thank you for watching.